Dr. Emem Omokaro, the Director General, National Senior Citizen Center (NSCC), says the center will continue to collaborate with relevant agencies to improve the health and well-being of senior citizens in the country. Omokaro disclosed this shortly after signing a Memorandum of Understanding (MOU) between the Federal Ministry of Health and the NSCC in Abuja. The MOU was signed during its stakeholders' engagement on development of a national benchmark for training of caregivers to older persons towards their certification in Nigeria.
The mandate of the National Senior Citizen Center is to identify the needs of older persons and to cater for those needs. And of course, you would know that the primary mandate for healthcare for the entire citizenry of Nigeria lies with the Federal Ministry of Health. And there is no way we would have embarked, even as initiators of, developing national benchmark statements and minimum standards in curriculum for the training of care providers and care agency operators without a formidable partnership with the Federal Ministry of Health. And of course, you would know that the Federal Ministry of Health has many agencies, under it, one of which is the National Primary Healthcare Development Agency, and of course, the National Council for Nursing and Midwifery. The Memorandum of Understanding today goes beyond today because we are looking at long-term care for older people. We are looking at a continuum of health and social care services, meaning that they are different. There's domiciliary care, the family care. There's the community care, which lies with the primary healthcare center. There are, different kinds of models of, you have respite care, you have hospices, you have palliative care, you have different kinds of care. And NSCC, as it is, does not have the professional departments to deal with these things. So that's why we thought that a memorandum of understanding for the Federal Ministry of Health and the agencies under it to own their statutory mandates at the same time partner with us, because our primary constituents are older people. So this MOU is primarily in all of us working together to develop an action plan for older persons in the health and social care sector.
Representative of the Minister of Humanitarian Affairs and Permanent Secretary of the Ministry, Dr. Nasir Sani Gwazo, commended the Center for mapping out a unique strategy towards achieving healthcare services to older persons in Nigeria.
Today, if there is a bomb blast, if there is a flood, if there is COVID, if there is social upheaval, if there is insurgency or mass insecurity, a good proportion of the people that will be affected will be the elderly persons. And they will be the last persons to run, and will be the first persons to become victims. Have you made special care for elderly persons in situations of national disasters or emergencies? Please, if you have not thought of it, include it in your view. I'm happy you touched on the special needs, the immunization needs, etc. But also, I would like to see where a program is descended down to community level. The care should be at the community level, including the hospital and immunization prevention care, so that they look at it as a normal part of their life, and that will encourage them to continue to enjoy those benefits.
Also, the representative of the Minister of Health, Dr. John Ovovoroye, assured the Center for the Ministry's commitment to providing strong synergy for improved health care for older persons in line with the universal health coverage.
With the MOU that we have just signed now, what it means is that there's going to be more robust relationship, robust interaction, and not only that, define clear rules and responsibility so that we can be complementing, not to be seen to be doing the same thing. Repetitiveness will be eliminated, and so we have that complementary kind of supportive things to one each of the agencies and ministries, and then repetitiveness and waste of resources will be eliminated. And so we will be coming from the health needs of the elderly people, they will be addressing the social needs of the elderly people, and so that robustness will continue to go on.